is Darmis Toribio, and I'll be your nurse practitioner. I'll be the one doing your health history today. Can you tell me if you go by your full name or if you have a nickname you prefer?
I usually go by Soul.
By Soul, okay. Are you familiar with the role of a nurse practitioner at all?
Not really.
No, okay. Nurse practitioners are actually registered nurses, so we're nurses that have more education and more clinical training, so we're able to provide acute care and primary care for patients of all ages. So that's my role. Have you ever seen a nurse practitioner before?
Around the hospital, yeah.
Okay, all right. Can you tell me what brings you here to the office?
I was told I need to do another assessment for my health insurance.
Okay, very good. Are you having any complaints right now?
No.
No? Okay. Can you tell me your full name and your address?
My full name is Soledad Sandoval,
Okay.
and my address is 6601 Haley Road.
Okay. And these are just things that we'll make a note of in your chart. Can you tell me your age?
I'm 22.
Okay. And your phone number?
It's 815-621-7697.
Okay. And your race?
I'm Hispanic.
You're Hispanic, okay. And where do you normally go to, for health visits or if you need health care?
At Rockland Memorial.
Okay, all right. Do you have a regular physician that you see there, or do you just utilize the immediate care?
Dr. Rogers is my primary physician.
Okay. I'm going to ask you quite a few questions here about your health history, and you can just tell me if you've had, any issues or with, what I'm asking you, okay?
Okay.
Can you tell me the date of your last visit, your last doctor's visit?
About a year ago.
About a year ago? Okay. And can you tell me why you were seen? Do you remember?
Also for the same thing.
Okay. All right. Very good. So it's not like you were sick or...
No.
Okay. And I'm going to just keep referencing my notes here because I have a lot of questions and I want to make sure I don't miss anything, okay?
Okay.
Can you kind of give me a brief overview of your any serious illnesses or chronic illnesses that you've had or are having?
I actually haven't had any, so
pretty healthy overall. Okay, good. Any problems with psychiatric issues, mental health issues?
No.
No? Okay. Can you tell me if you're up to date with your immunizations, your shots?
Yes.
Are you? Okay. Did you have a flu shot this year?
I have.
Okay. Ever had a pneumonia vaccine?
That I haven't.
Okay. Do you know the last time you had your tetanus shot?
About a couple years ago.
Okay. And you work at the hospital, you said?
Mm-hmm.
Okay, probably, well, depending on what you do you have the, I always blank on that, the TB shot. You get that every year?
Yes.
Okay, all right, I'm
a
sorry.
CNA, so I get that every
year. Any exposure to anything communicable like hepatitis or tetanus that you're aware of?
No.
Okay, good. Do you have any allergies? And this includes any drug allergies, seasonal allergies, environmental allergies, or food allergies?
No.
No? Okay. Are you allergic to latex or penicillin?
No.
No? Okay, very good. Any past hospitalizations or serious injuries or accidents?
No, I had a minor car accident a couple of years ago, but I was fine. No injuries.
You didn't have to go to the hospital or anything? Okay, very good. Any emergency room visits that you've had? No? Okay. Any accidents, any harmful ingestion of anything harmful to your body?
No.
No? Okay. Flip my paper here. And can you tell me what medications, if any, that you're on at home? And this includes any prescription medications, any over-the-counter, any herbal medications?
I take ibuprofen once in a while for cramps.
Okay. And how often do you take that?
I take it maybe every 6 hours if I need it.
Okay. And do you know the dose that you take for that?
About 200 milligrams.
Okay. All right. Very good. Do you use any homeopathic or any complementary medicine, any acupuncture, massage, oriental therapy, anything like that?
No.
No? Okay. And then I'm going to ask you some questions about your family history. Are your parents both living?
Yeah.
They are, okay. And what about grandparents?
No.
No? No grandparents?
No grandparents.
Okay. Do you know about how old they were when they passed and what they passed of?
No, I was still pretty much a baby around that time, so I
Okay,
don't know.
all right. And any siblings?
I have one sister.
One sister, okay. And any aunts and uncles on both sides?
I have an aunt and uncle on my mom's side, and then just an uncle on my dad's.
Okay. As far as family, can you tell me a little bit about any health history that you might know?
My dad's pretty healthy.
Okay.
I know my mom has asthma, and she has some seasonal allergies.
Okay. Let's see. Any illnesses? You said your mom has allergies.
Mm-hmm.
Okay. Any history of asthma or high blood pressure?
No.
Any history of heart attacks or strokes? Okay. Any history of vascular issues in your family?
No.
No. Okay. Any diabetes or cancer?
No.
No. Any cystic fibrosis or gastrointestinal disease? And if I'm saying something that you don't understand what it is, then please just let me know, okay, and I'll elaborate.
Okay.
Any gout or kidney problems?
No.
No. Any sickle cell or thyroid issues?
No.
No. Any blood disorders or problems with obesity?
No.
No. Any vision or hearing problems? Any genetic or congenital diseases?
No.
No. Any sudden infant death syndrome problems? No. Any neurologic problems including seizures?
No.
No. Okay. Any emotional problems or learning disabilities?
No.
Any history of mental retardation?
No.
No. Any alcohol or drug abuse in your family?
No.
No. Okay. Do you have any concerns of any family members and any health issues that someone in your family might have?
No.
No. Okay. Can you tell me a little bit about your current living arrangement?
Right now I live with my parents,
Okay.
and that's fine for now because I'm in school, so that kind of helps out a bit.
Oh, okay. Well, that probably does help. Do you have any stressors at home that, with your living arrangement right now?
No.
No? Okay. Do you get along with everybody in your family for the time being?
Yes.
Okay. All right. Very good. As far as your work history, can you tell me, you said you're a CNA,
Mm-hmm.
and where do you work?
I work at Rockford Memorial.
Okay.
And before that, I worked at a nursing home.
Okay.
And before the nursing home, I used to be a gymnastics coach.
Okay. All right. It's different. Do you have any issues with your occupation right now?
No.
Okay. Any exposures to anything environmental or occupational hazards that you encounter on a daily basis?
No.
No? Okay. As far as financial resources, do you have any stress about how your finances are right now?
No.
Okay. Any stressors with your family's financial resources? No? Okay. And can you tell me a little bit about your schooling? Did you complete high school?
I completed high school,
Okay.
and I'm taking my last semester to finish my associates in arts.
Okay, well that's exciting. And what are you studying for?
After I do that, I'm going to transfer to Rockford College and major in political science.
Okay, great. Let's see. And I'm going to ask you a little bit about your social background. Do you drink or smoke any tobacco?
I drink socially, but I don't smoke.
Okay. How often would you say you drink?
Maybe about once a month.
Once a
So
month?
not that often.
Okay, so, and when you drink, how many drinks would you say you have?
2 to 3.
Okay, alright. You said no tobacco, any caffeine?
No.
Any other, illegal drugs, any marijuana, heroin, crack cocaine, okay. As far as sleeping, how many hours a day would you say you sleep? Or hours a night, I'm sorry.
Maybe about 7.
7? Okay, that's pretty good. Do you have anything that keeps you from having a good night's sleep, or any disturbances that you encounter?
No.
No? Okay, very good. Do you exercise at all?
Not really.
No. Okay, well, sounds like you're pretty busy. So no exercise. Okay, well, you're pretty, I mean, you're not obese by any means right now, and so, I mean, if you ever can get a chance to get some exercise, and that'd probably be a good stress reliever for you too. Can you tell me, or can you describe a typical day from the time you wake up to the time you go to bed? Just, typical day for you.
I usually wake up at about 6-ish.
Okay.
And get ready for school. I go ahead and have some cereal. I'll go to class, and when I come back, I usually will have some lunch and do some homework, and then I'll go to work. I don't get home from work till about 11-ish, and then I'll go ahead and get ready for bed, and that's pretty much it.
Okay, all right. Can you? I know this is gonna maybe be a hard one, but the past 24 hours, can you tell me, or can you try and recall what you had to eat, like throughout the day, starting with breakfast and all up until right before bed?
Some Lucky Charms for breakfast.
Okay.
And then I had some rice and some beans for lunch. And then I'll probably go home after this and I'll eat again.
Okay.
Something similar to that.
All right. Is that a typical meal for you?
Yeah.
Or, is that a typical 24 hours for you as far as your eating habits? Do you eat out a lot?
No.
How often would you say you eat out? Like, let's say in a week.
Once, maybe.
Maybe once. Okay, well, that's good. As far as stress, do you feel like